What is status epilepticus? Have you ever wondered what happens when a pet experiences a seizure that just won't stop? This situation is known as status epilepticus. It is a serious neurological emergency that can affect both dogs and cats. In veterinary medicine, status epilepticus occurs when a pet has a seizure lasting longer than 5 minutes or has multiple seizures without regaining normal consciousness in between. This condition is life-threatening and demands immediate veterinary care. Typically, a seizure in pets lasts just a few minutes. Afterward, they usually go through a recovery phase where they gradually return to their normal selves. However, in status epilepticus, the seizure activity continues without stopping on its own. This prolonged seizure activity can lead to severe complications. These include dangerously high body temperatures, potential brain damage, and even death if not treated right away. Common signs of status epilepticus in pets include uncontrollable shaking or jerking movements, loss of consciousness, paddling of the limbs, excessive drooling, and loss of bladder or bowel control. Sometimes, pets may vocalize during these episodes. Even after the visible seizure seems to stop, pets might still have subtle seizure activity, like twitching of the eyelids or lips, especially if they are heavily sedated. From a veterinarian's perspective, status epilepticus is considered a medical emergency. The primary goal is to stop the seizure activity as quickly as possible. This is often done using intravenous medications, such as benzodiazepines like diazepam, commonly known as Valium. The aim is to stabilize the pet and prevent further brain damage while addressing any underlying causes. Supportive care is also essential in managing status epilepticus. This includes monitoring the pet's body temperature, providing oxygen if necessary, and sometimes requiring hospitalization for ongoing observation and treatment. After experiencing status epilepticus, pets may take several days to recover fully. Some may even face temporary blindness or other neurological changes during their recovery. For pet owners, having an emergency plan is vital if their pet has a history of seizures. This plan should include knowing how to recognize status epilepticus, having contact information for an emergency veterinary clinic, and keeping a seizure diary. This diary can help veterinarians track the frequency and severity of seizures. It is important to note that status epilepticus is not a diagnosis on its own. Instead, it describes a life-threatening situation that can arise from various underlying causes. These may include epilepsy, brain inflammation, exposure to toxins, or metabolic disorders. Early recognition and rapid veterinary intervention are essential for the best possible outcome.